Brian Nealon is the CEO of the Wesley Community, a nonprofit agency which serves the needs of the elderly, as well as active seniors, adults, and pediatrics. Brian oversees the daily operation of the Wesley Community and the Wesley Foundation, addressing legislative matters and educating officials and the general public about advances and barriers to securing the future of long-term healthcare. Welcome, Brian. Thank you for joining me today.
Walter, it's a pleasure. Thank you for having me.
You're very welcome. Now, as I was kind of preparing for this, I was wondering, who is the Wesley Community and what is the role in the community?
Yeah, the Wesley Community is we provide a collection of senior services on our campus in Saratoga Springs. We have skilled nursing, we have assisted living, affordable senior housing, market rate senior housing, home care. We even have in our outpatient therapy, we even have a pediatric practice.
So how does Wesley play a role as a major employer in the area?
We employ over 500 people on our campus in Saratoga. We also are caring for 600 seniors. And we are one of only 2 programs in Saratoga County that is certified by the Department of Health to train people to become certified nursing assistants. And that's a critical part of how we care for the elders.
Now, every business has challenges. I'm interested in knowing, what are Wesley's funding challenges and how does Medicaid reimbursement play a role?
That is a great question, Walter. Every nursing home in New York, it should qualify, almost every nursing home in New York is going to live or die based on Medicaid reimbursement. Medicaid serves as our primary payer for our residents in our nursing home, and the state's Medicaid system hasn't been updated in over 15 years. Currently, we and most other nursing homes in New York are getting paid. Our Medicaid rate is based on our cost from 2007. There's been about a 9% increase over that period of time, but inflation has been at 47%. So there's well over a 30% gap in loss in purchasing power versus what we're getting paid to care for our residents. Earlier this year, Governor Hochul and the state legislature approved a 7.5% increase in Medicaid reimbursement for nursing homes. We are incredibly thankful for that. But at the same time, it should be noted that the state went 14 full years with a 0% increase to Medicaid nursing home rates. There's still a very significant gap between what we're reimbursed and what our cost is. Our cost right now is about 32% above what our reimbursement rate is.
Wow.
So it makes it incredibly difficult to get to something even close to a break-even bottom line on an annual basis. And as nursing homes have struggled, and we've had to close some beds, and us closing beds is not unique. There's many others in the state that had to do the same. There's a trickle-down impact, which the community should be aware of, that many of the folks that we admit are coming directly from the hospital. And if we don't have beds available, they're sitting in the hospital at a much higher cost to the system. But also, the hospital then struggles with, where do we put these people? And wherever we put them, it limits our ability to take in acutely sick folks, people that are arriving at the emergency department. And that is not what any community wants to see. We want hospitals to be hospitals, caring for those that are in urgent need, not a place that is holding on to potential nursing home residents.
So for a final question, as you highlight those challenges, how can people support Wesley's mission?
I think there are a couple of ways. First, and while we don't have this up quite yet, if being in contact with the governor, being in contact with your state legislators, and just talking about the fact that nursing homes have went 14 years with a 0% increase and currently need the attention of the legislature and the governor to make sure that the kind move that they made last year continues again in this upcoming budget year.
Well, Brian, it was a pleasure speaking with you and learning more about the Wesley community. We look forward to seeing your leadership in action and welcome you to the business community in Albany. Thank you for joining me this morning.
Walter, it's been a pleasure. Thank you so much.
Thank you, sir.